Good morning, everyone, and thank you for joining us. My name is Brittany Resendiz, and I'm the Member Communications Coordinator here at Commonwealth Purchasing Group. For those of you that are unfamiliar with our program, we are the leading group purchasing organization for community health centers and other nonprofit organizations. We're very excited to have Mark Robledo, President and Founder of the Crossroads Group, lead our discussion today on measuring patient experience through surveys. The Crossroads Group specializes in serving the unique needs of community health centers and is currently one of the leading providers of patient surveys for community health centers with a client retention rate of over 95% since starting in 2005. Our webinar today is designed to last for 1 hour, allotting us 30 minutes for the presentation portion and 30 minutes for the question and answer. As you can see now, your line is currently muted. When we reach the Q&A portion, you may type your question into the question box, which is located on the control panel, or if you'd like to ask your question directly over the line, please use the raise your hand option, which will allow us to unmute your line and you can ask your question directly to Mark on the phone. And before we get started here, we'd like to open up a poll question for you. At this time, if you could please draw your attention to your screen, and we will launch the poll question. The question asks, what is your current process for administering patient satisfaction surveys? And we'll leave the line open for about 1 minute or so you can answer the question. And please keep in mind that when we broadcast the results, only percentages will be shown and no individual answers will be broadcasted. Okay, great. So at this time, I'm just going to broadcast the results. Looks like 93% are internally measuring their patient satisfaction and 7% are using a vendor. So at this time, I'd like to hand it over to Mark. Thanks for being with us today, Mark. Why don't we get started?
Great. Thank you very much, Brittany. And thank you all for joining us this morning. As Brittany mentioned, my name is Mark Robledo. I'm the president and founder of the Crossroads Group. And I'm here this morning to provide you some information about us, but also some tips and suggestions for you as well. A little bit about us. We work with almost 70 community health centers around the country, mainly on the East Coast and also on the West Coast of the U.S. And we've been providing patient survey measurement services since 2005. We specialize in that. We specialize working with community health centers and benchmarking their scores relative to one another. We also provide employee satisfaction and engagement surveys for our clients and pharmacy patient experience surveys. So those are our three core services: the patient, the employee, and the pharmacy patient surveys. We have over 15 years of community health patient survey experience, so we're unique in the fact that we have worked with hospitals, but we don't come from a hospital survey background. We really have grown over the years working with community health centers, and we have over 95% client retention for our patient survey process. And one of the things that makes our service unique, it's very cost effective, and we'll get into that in a little more detail, but our reports are designed to be very actionable and intuitive and easy to use, easy to understand, because we recognize that not all the end users are statisticians. And that was one of the things I learned back in the 90s working with hospitals. They would get their patient survey results from a vendor, and most people really did not understand what they were looking at. So we provide very intuitive, actionable reporting that is ideally used as a scorecard for leadership and for the board to see how the organization is doing. But it's also, equally importantly, used as a tool to drive improvement. And a lot of our clients have been able to use our reports as a tool to implement actions and improvement, both from a process perspective as well as a staff interaction perspective with their patients, and move the needle and improve their relative standing in the benchmark. So both elements are critical. A few thoughts as it relates to service. I know right now we've been in the midst of a political season, and it's very easy to get caught up in all of that. But one thing that never changes is the need for good service, quality service for your patients. And I love this quote: 55% of customers would pay extra to guarantee a better service. And sometimes I've worked a lot with community health centers, and sometimes the mindset with staff is that, we're giving patients a low fee or a sliding fee. So because of that, we don't need to be excellent in service because they're fortunate that we're here for them. I've seen that mindset many times, and this quote is very powerful because oftentimes patients will pay more to get that quality service. And on the flip side, we have some health centers that we work with that are so excellent that they're able to incorporate a sliding fee scale where they're getting $50 on their sliding fee payment for their self-pay patients out in California, and patients are more than willing to pay that extra. A lot of the health centers we work with, it's a much lower amount, but this particular organization, because they're so good, they have a higher sliding fee, and the patients are more than willing to pay that because of the value they get in the service. So there are financial implications. Customers 4 times more likely to defect to a competitor if the problem is service related rather than price or product related. So a lot of times the reason health centers will lose patients is because of service issues rather than the price or the quality of the clinical care. It oftentimes has to do with things like wait time or appointment access or staff interactions with the patient. For every complaint, you can't depend on complaints because most people will not complain. So for every complaint, there's approximately 26 other unhappy customers who've remained silent. So the complaining customer is really the tip of the iceberg. There's a lot more patients out there that will not voice their concerns. 96% of them, according to this estimate of unhappy customers, do not complain. However, 91% of those will simply leave and never come back. And I'm sure as a consumer, we all consume in different areas. I know as a consumer in restaurants or other service-related places, if I'm not happy, I probably won't complain, but I probably also won't come back again. Dissatisfied customer will tell between 9 to 15 people about their experience. When people are unhappy, they like to oftentimes tell others, unfortunately. And around 13% of the dissatisfied customers will tell more than 20 people. Okay, so the word of mouth, your image in the community is really driven by your customers and what they're saying after they walk out the door. A 5% increase in customer retention can increase profits by 25 to 95%. And a lot of organizations right now are focused on PCMH, Patient-Centered Medical Home, and the CAP survey, and there's a number of standards that go with that, and those are extremely important, and those are good, and those are experiential metrics. But unfortunately, it is possible to do really well in PCMH and not do so well in terms of your client satisfaction. It's possible to do well in PCMH and not do well in loyalty, referral intentions, and other service-related measures. So the two are not mutually exclusive, but the two need to be emphasized because service and PCMH can move together and both improve, and that's what we try to do. We try to incorporate metrics related to both areas so that you're not moving the needle on one, but then dropping on the other. Quality survey measurement process is foundational because without a measure, you really don't know how you're doing. There's a lot of apathy out there when it comes to service, and settling for the status quo is not an alternative that we recommend. According to one study, 80% of executives think they're doing an excellent job serving customers, yet in that same pool, only 8% of the customers agreed with that evaluation of receiving excellent service, and as a result, the average company or organization loses more than half its customers within 4 years. For a health center, customer turnover is highest for patients who have choices and alternatives. So that turnover is oftentimes going to be with your insured population, and it's also going to be more evident in organizations that are in an urban environment because there are more alternatives are present. So direct, objective, and candid patient feedback from a neutral third-party source can really positively affect organizational culture. And unfortunately, the problem with internally administered surveys, a lot of organizations go that route for the prospect of cost savings, but there's the hidden cost of the staff time involved with data collection. But equally important, there's also the perception that those results are not really representative of the patient population. So there's a credibility issue that sometimes comes into play with internal surveys. Patient satisfaction and experience is also related to clinical outcomes. So if we have any clinicians in this audience, this will be a good slide. According to 13 clinical studies, a positive doctor-patient relationship can have statistically significant effects on hard health outcomes related to obesity, diabetes, hypertension, and other outcomes. And that's from an article, Why Nice Doctors Are Better Doctors, because there's more continuity of care, the patients are more open, they're participating in their care, and they're also following through on requests as it relates to medication and other health outcomes. Patient satisfaction and experience is also correlated to financial results, and there is some research on this in the hospital industry. And the top quartile of patient satisfaction scores versus bottom quartile patient satisfaction scores in a very large database of hospitals revealed that hospitals in the top quartile are actually earning 79% more, so they're making more money. You don't lose money by having excellent service and measuring it. The reverse is true. There's a correlation between doing well in service and earning more financially. And this is a good one for the CFOs, because sometimes CFOs don't want to invest in service initiatives, but there is a good ROI on that, and it's demonstrated in research such as this. In terms of the link between employee satisfaction and engagement, there's also a very strong correlation between client satisfaction and employee satisfaction. And there's a lot of research out there that shows a quantifiable link between customer service variables such as satisfaction and loyalty and employee-related variables such as satisfaction, enthusiasm, commitment, capability, and engagement, of course, as well as financial results. So these also correlate. Employee satisfaction and engagement will make good service a lot easier. It doesn't guarantee it, but it definitely is a precursor to quality service. And the missing piece for a lot of health centers right now is that they don't have an actionable stakeholder reporting system. And this is why we as an organization got involved with community health centers over 10 years ago, because we saw such a need. We saw a lot of organizations that were trying to implement a survey process on their own that just really wasn't, frankly, working for them. And we've seen tremendous need out there for a quality, cost-effective, benchmarkable survey process that alleviates their staff completely from this process, while at the same time providing actionable information. And as Peter Drucker said, if you can't measure it, you can't improve it. But we added, if you can't measure it well, because it has to be a trustworthy measure and a quality measure, you can't improve on it. And now we're going to have a couple more polling questions for you to help us better understand your needs. Brittany, I'm not seeing the polling questions, so if you can let me know once those are completed.
Sure thing. We currently have the poll up now, which is how would you rate your organization's current survey measurement process? If you are just listening in and you'd like to draw your attention to the screen, we'll have that open just for a couple more seconds here. Okay, and now I'll be broadcasting the results. As you can see, looks like the majority of people voted good and fair on the measurement scale, with a few voting poor, and actually no one voted excellent on this poll question. And like Mark had just mentioned, we are opening another poll question here for you. And this one is, what specific concerns do you have as it relates to your current survey measurement process? And you can select any of the following answers that apply. Okay, great. And now I'll be broadcasting these results as well. For the responses, we got 47% for burden on staff resources, 63% for sample sizes too small or infrequent, 63% for results not entirely trustworthy or credible, 37% report quality, usefulness, or timeliness, and 11% vendor issues, which could include cost, value, service, etc. And Mark, why don't I hand it back to you?
All right, fantastic. So sample sizes not being frequent or large enough, staff burden, results not being credible. Okay, so a few key questions as you introspect and look at your organization's survey process and consider possible alternatives. You want to ask these questions. Is your focus, what is the purpose of your survey? Is the focus on improvement as an organization, or is it on third-party recognition? So the answer to that question will determine what type of survey that you implement. You may want to implement, if it's strictly PCMH, you may want to implement a CAPS survey or once a year. You may want to implement a shorter survey because the CAPS survey, a lot of health centers are concerned with the length of that survey and the cost of implementing it. So you might want to have a shorter survey that captures some of the metrics that are PCMH related. It may be HRSA related. Sometimes we have clients that come to us and they want to incorporate questions that they need to report related to HRSA. And one example is the sliding fee scale perception question that some of our clients want us to include. Maybe you have some grant funding sources that you need to incorporate questions related to. Maybe it's service. Maybe you just want to deliver better quality service. Or maybe it's a combination of these and you want to integrate all of that into one survey, which is what we often do. What questions should we ask our patients? Now, we offer all of our clients a question bank because we've been doing this for over 10 years and we have a set of validated field-tested questions that are benchmarked very heavily. So we provide that as a possible menu, if you would, of questions that can be included on a survey. But the questions, very similar to the first item above, may relate to satisfaction, patient experience. And experience, the difference between satisfaction and experience is experience asks, what happened during your visit, or did this happen, yes or no? And then satisfaction relates to, well, how do you feel about that experience based on your expectations? It incorporates the expectations of the patient as it relates to that experience. How do we earn points for PCMH? If you have questions on that, I can help your organization. Feel free to contact me because I'm pretty well versed on how to maximize your point potential for NCQA's PCMH process as well as Joint Commission if you're going that route. What methodology works best for our population? There are some vendors that are trying to implement patient surveys using email or mail or a hybrid approach. Our methodology, what we find works very, very well is the phone survey. So we do a live person phone interview. We don't use robocallers or automated systems. It's a live person interview. We find that for community health center patients right now, that is the best methodology. Should we outsource this or conduct surveys internally, or maybe a combination of both? That is a key question. There's pros and cons on both ends. If we outsource, what should we look for in a survey vendor? And how do we compare and assess survey vendors? Those are key questions. How do we engage staff to use survey results? And by the way, as far as comparing and assessing vendors, our best client is one that does a lot of research and a lot of comparisons. We just contracted, for example, with Waianae Coast Comprehensive Health Center in Honolulu, and they did a ton of research over a lengthy period of time, comparing us to 3 or 4, I believe, other vendors, and they had a checklist of things. And after they did that robust analysis, they did choose to contract with us. But we strongly encourage you to really, if you do decide to look at a vendor, we could provide you some insight in terms of what questions do you want to ask to kick the tires, so to speak, on that survey process, because there is a lot more to surveys than initially meets the eye. How do we engage staff in actually using the results of the survey? So that's very important, that you're not just getting a quality report, but then it's not really going anywhere. How do we accurately assess score changes over time, as well as comparisons to other organizations? So one is a longitudinal baseline comparison to yourself, and the other is benchmarking to other similar organizations. And what sample sizes are needed for our survey, and we can help you with that. Oftentimes I get the question, how many surveys per provider do we need to have? Because a lot of health centers are focused on measuring survey results at the individual provider level. And we recommend 40 surveys per year per provider. That is kind of an industry norm. Some of our clients will go a little higher than that, but that's the kind of the norm as far as individual provider sample sizes. As far as departmental or site sample sizes, there are some online calculators that you can just Google sample size calculator and you'll find some free tools, and you can plug in the population size and the sample size and the confidence level, and it'll give you the resultant sample size needed there. And then how frequently should we sample? Most of our sampling is quarterly, so we sample throughout the quarter, so it's a nice even distribution so that staff don't think that, okay, we're doing the survey this week, so we're going to be at our best. We prefer to broadly sample over a period of weeks, so there can be no what's called Hawthorne effect, which is where there could be some influence based on knowing that the sample is occurring, and then we provide the reports quarterly. We also have a monthly reporting process as well. And what makes our process unique, and these are some of the things you want to look for if you're looking at vendors, we can customize the sample size target per quarter. So we predefine the completed survey count. Most vendors will predefine the attempts. So they'll say, okay, we're going to draw a sample of 500 patients, for example, and then we'll see what we get. You know, we're going to mail out some surveys or send some emails, and hopefully we'll get a good return. What we do is we say, okay, how many surveys do you want to have at the end of the day? And then we meet that target, and we only bill our clients for completed surveys. We do not bill them for attempts for a patient survey. And we can customize that by health center or by team or by individual provider. So if an organization wants, let's say, 40 surveys per provider or 10 per quarter per provider, we can meet that target and balance those counts across providers as well as departments. And as I mentioned, it's 100% live person, bilingual phone interviews conducted by a personable and professional individual who will represent the organization well. We contact patients a week following the encounter, so we're not conducting surveys over the phone in relation to a visit that occurred weeks ago. But we find that if we can contact patients very quickly after the visit, there's two big advantages. One is you get a better quality survey because the validity is strong because the patient remembers the visit, but also you're able to do pulse reporting and trend how you're doing from week to week or month to month or quarter to quarter in terms of your survey results. We report by location as well as aggregate, by department and individual provider. We also do a lot of other analytics. Another advantage of the phone methodology is you capture a lot of comments because it's a live person interview. Patients will, if they say they don't like the front desk staff, we can ask them why, and we can probe and get details that are very supportive of not only recognizing staff or correcting staff, but also getting to the root of any issues that are taking place. And in your survey process, you can also integrate specialty areas, urgent care, dental, behavioral health, ancillary departments, as well as pharmacy patient perceptions. We're able to do that in our survey process, so that's a good thing to consider. And then as I alluded to earlier, we recommend combining satisfaction and experience, not just focusing on the experience questions, because if you do that, you may find that you're doing really well on your PCMH measures, but your patients aren't happy because they're not getting what they're looking for in terms of service. Reporting features, this is just a menu of reports, and I won't spend a lot of time here because we could spend another hour going through sample reports of all of these, but basically what you want to include are some aggregate reports for medical, dental, and behavioral health if you have all three of those. Some of our clients also have vision now, so we incorporate that as an aggregate department and see how the organization is doing, both in terms of scores and comments. Each location should have their own standalone report so that the representatives from those locations can take their survey results and act on them at the local level. And then also departmentally. So you might have adult med, pediatrics, OBGYN, and departments within the spectrum of medical that also need to get reported in terms of those scores. Individual provider scores. We also report by a reception desk or check-in area. So if there's a location that has multiple check-in areas, each of those check-in areas gets their own scores for service from the reception staff, as well as the wait time experience and the communication levels. Service recovery reporting, this is when dissatisfied patients express dissatisfaction and give us permission to forward their information to our clients so that there can be a response there. And then leadership cross-tabulation is an analytical tool to look at things like scores by payer type or gender or age or language. And then we have some drill down reports related to the two Achilles heels areas for most health centers is appointment weight and provider weight. And those help drill down and get additional insight into what patients are perceiving there. And then, of course, we have national benchmarking, and we often do a regional benchmark. For example, in the state of Massachusetts, we have a state benchmark, but we also have other regional benchmarks as well. Here's a sample benchmark table. So you can see the overall satisfaction question, the organization scoring 93.6 versus the benchmark 86.4. This was actually, I think, the top scoring health center in fourth quarter of 2015 for medical. And they were up by 7.2 points relative to the national mean, which was statistically significant because it was more than 2 standard deviations above that mean score, and they ranked #1 in the benchmark on the mean as well as the percent excellent. And so as far as us as an organization, we're very well known among community health centers. We have a lot of clients that we're working with that can serve as references. We customize, we work with our clients to really ensure that the questionnaire that they get and the reports they get are tailored to their needs. And core and flex just means that there's usually a set of core questions that everybody gets for benchmarking, and then there's a flex component where they can tailor the questions that they're most interested in on the survey using a validated question bank, guaranteed sample sizes and deliverable dates, national and regional benchmarking. We also include executive summaries and analysis, and I'll show you a brief sample of that. We have no long-term contract commitments, so our clients, when they engage with us, are not committing to a year or any defined time period, and there are no project management fees that some of the vendors like to build into the contracts. We only invoice completed surveys, and of course, as I mentioned, we have those other services available. And if you have any questions, you can contact. We're going to open it up to Q&A in just a moment, but my contact info is also on there. And I want to show you briefly a sample exec summary. So each quarter, our clients get an executive summary that has a table of contents so they can see the medical patients, dental patients, supplemental analysis, and then the verbatim, a sample of the verbatim comments. So if they want to go to overall satisfaction, they can see Q1, Q2, Q3, the mean score. It's very intuitive, very easy to read. So they get that trend information so they can see how the scores are moving from one quarter to the next for medical relative to the historical baseline. And then we also incorporate some analysis and commentary as well as whether the score change is statistically significant. We look at loyalty, referral intentions. I'm moving fairly quickly for the sake of time, but some ranking scores to see what the high scores were and the lowest scores, as well as the net score difference from one quarter to the next. So in this example, appointment weight satisfaction improved by 2.6 points, which is evident here. It's very visual, so they can say, wow, we're making some improvement here, and that improvement was statistically significant, and that's why we put that little symbol there. And then conversely, the referral department staff friendliness and helpfulness score was dropping in that particular quarter. And then we look at the experiential questions. We do a similar analysis here. And then we have dental patients, and I'm going to smooth past that because it's very comparable to what we just saw. Then we have reception analysis. phone access on this template, and each PowerPoint will be a little different in terms of what it includes because the analysts will be extracting key observations that they see in the reports. But this is a question about how long did it take for you to get through on the phone to schedule your appointment, and how they rate the phone attendant courtesy and helpfulness. And you can see this is based on an actual client. This organization improved from 86.8 to 87.7 to 89.1 on the mean score for their phone attendant courtesy and helpfulness. So that shows me that they were actually using this information to improve. We can look at things like appointment wait experience for medical, dental, and behavioral health, as well as the provider wait. How long did they wait to see the provider, and how satisfied were they with that? And I see also this organization is improving in the third quarter. And then patient comments. As I mentioned, we like to capture verbatim comments, both positive and not so positive. And these are actually based on real comments from real patients. Remember that referral process score that was dropping? Well, there's a comment related to it. So when they see the score, they can read the comment and get more insight. So I want to leave some time for Q&A. So I'm going to go back to the original presentation and open it up for questions.
Great. Thank you so much, Mark, for doing a short overview on the scoring process. Like Mark mentioned, we are opening it now for Q&A. If you have any questions, you can type them into the question box, which is located on your control panel. Or if you'd like to ask your question directly over the line, you can use the raise your hand option, also located on your control panel, which will allow us to unmute your line, and you can ask your question directly. While we're waiting for some questions to come in here, I'd just like to mention that we are recording today's webinar. So if you're interested in watching the recording or sharing it with some of your staff, you may do so, and we will be sending that to you tomorrow or the next day with a full recording of the video. And if you'd like a copy of the slideshow, we can also send that to you as well. It doesn't look like we have any questions coming through as of yet, but we do still have some time here on the line if you'd like to ask your question today. If not, please take down Mark's contact information, which is on the slide shown here on your screen, and you may contact him directly via email or phone if you'd like to do that. Please feel free, and we'll include that information in the follow-up email as well. So if you didn't have time to take it down, you'll still have a chance to contact him directly if you'd like.
And since we have a couple minutes and we don't have any questions yet, everyone's always interested in provider scores, so I thought I'd pull up a little example of a provider score report. So you can see here the individual providers listed, and you'll also see how the sample size per provider is almost identical for each of the providers. And we have provider listening, time spent, explanation of care, and you can literally go across and compare those scores to each other and see how the whole group score, which is the combined average for each provider, you can see how you'll see differences in those provider scores going across. And this is a very, very good tool for a lot of organizations that are recognizing in different ways providers for their service delivery to their patients. This was a larger organization that had quite a few, and then we also break out a provider influenced score section, and this is things like the medical assistance or the provider wait, the appointment wait. So these are things that the providers do influence, but they don't have total control over. But you'll also notice big differences as you go across in terms of the scores. And if anybody would like to contact me to look at some sample reports, feel free to contact me directly. We've got quite a few of them.
Great. Thank you so much, Mark, for going over that. That's great. As Mark mentioned, if you would like to learn more, if you're interested in any of the reporting or the scoring that Mark went over briefly, please feel free to contact us directly. Either you can contact us here at CPG, or if you'd like to contact Mark directly, and we'd be happy to go over that with you. Mark, it does look like one question has come through. The question is, how many special services can be added? And I believe that's referring to the reports.
Special services, yeah, we're very flexible with our clients. We work with them in terms of what their needs are. So if it's in relation to the reports, we can customize that. If it's in relation to the survey itself, we can also customize that. If by special services you mean other types of surveys, oftentimes clients will come to me and say, look, we need a survey for our HIV patient population. We have a grant and we need to measure our HIV patient population. Can you help us develop a survey? Sometimes clients will come to me with a market research type survey need. So there are anything that's survey related, we can develop a customized survey process for you based on your needs and objectives.
Okay, great. The question specifically was in terms of behavioral health, for example. Do you think that would be an option as well?
That is absolutely an option. It's an option that we're doing a tremendous amount of work in presently. It's our fastest growing population in terms of department or specialty. Our approach to behavioral health is a little bit different in the sense that behavioral health patients often come for multiple visits sequentially, either week to week or every 2 weeks. So we've designed this year actually a survey that better reflects the needs. We've gotten input from behavioral health leadership and management, and we've developed a very similar survey process but slightly adapted for behavioral health population needs. So that is right up our alley. We just started working with Lynn Community Health Center in Boston, and they have a very large behavioral health population. We're also working with Yakima Valley Farm Workers Clinic that has a behavioral health services side, and several other organizations that are very, very focused on that right now.
Great, thank you so much. I think that answered the question very well. And if anyone else has a question, please feel free to type it into the question box now. We do have about 15 more minutes on the line here, and we'd love to get your questions in if we can. Okay, looks like we have another question that just came through, and the question is, how would your phone survey process work when our population seen do not have stable telephone numbers?
Yeah, we're pretty used to dealing with that. We deal with a lot of clients that have migrant worker populations that are using those, I think they're called cricket phones or temporary phones. And we essentially, because we contact patients so quickly after the encounter, so we get the population of encounters that were seen the previous week, that improves the quality or the likelihood of being able to reach people that have temporary phone numbers. If we call a phone number and we find that the number's not working or it's not correct, we will document that and we'll move on to another patient, and it's a random selection process. There's no cost for the attempt, so that's something that we kind of have to absorb in terms of man hours on the phone. So the client doesn't pay for the additional time invested in calling phone numbers that don't work. Sometimes our clients, in relation to that, will ask us to provide them with some documentation in terms of how many of their phone numbers are not correct. That was a bigger issue about 10 years ago when we started. We found that with the newer EHR systems and the more increased emphasis on collecting patient demographic information during the visit, that the quality of the phone numbers and the data that we're getting is much better. The other answer to that question is you might have some homeless patient populations that don't have phones at all, even though some of them do. And we have a separate survey process that it's relatively rare, but we do have a couple of clients that have that need, and we can implement a survey process, but that would have to be on site, where the data or the surveys are administered on site, and then we process those results. But that's a very, very small fraction of the total population. Generally, contacting patients by phone is not an issue.
Great, thank you so much. Looks like we've got another question here. What other methods can be used to capture the survey? Can you provide tablets, Palm Pilots, etc.?
That's a very good question. Some organizations are looking at the possibility of providing tablets and on-site type surveys. We've seen that piloted. We have done a little work in that area, but we found that it doesn't work as well because whenever you have a survey that's administered at the site, there's the potential that the people who complete the survey are either going to be biased in the direction of very satisfied or dissatisfied patients. Dissatisfied patients especially are the ones that are most likely to want to complete an on-site survey because they want to vent, they want to get that off their chest. The other issue there is some patients will have a hard time with the technology. They're not as savvy with it, and they struggle with it. It can also create a little bit of a bottleneck in terms of the patient flow. And the other issue as well is that it has to be a very short survey. If you're going to do a tablet survey, it needs to be, and our recommendation would be 5 questions or fewer. So keep it really, really short, really, really simple. But to answer your question, it's not something that we're currently offering, but it's something that we're considering. But we strongly believe that with the phone survey conducted post-encounter, after the patient has left, you're going to get a better quality result, a more randomized survey. The patient's going to be more candid in providing feedback, and it's just going to be a better quality survey overall.
And Mark, what about the patient portals? Can the surveys be added to the portal so the patient could do the survey directly from their home?
That's a good question. It's not something we've done, but it could be done. We do online surveys for our employee surveys, for example, so we have a lot of experience using online platforms. But oftentimes with the portal or a website survey, the people that we recommend using that more as a comment feedback mechanism. So if a patient leaves and they have some issue, they can go online and share their concerns or their experience. But again, you have the same problem as with the tablets. You're not going to get as randomized a sample. Random sampling is so important when it comes to surveys, and the phone methodology really, really facilitates that better than any other methodology because we randomize who gets called. It's completely random. And once they pick up the phone, over 90% of the respondents or the people who pick up the phone will participate with us in the survey. So you truly get a random survey and a random sample of people that otherwise would not go online to complete a survey or that otherwise would not complete a survey on a tablet. So that's the big advantage. Now, having said that, there is a place, I believe, as a complement to a phone survey that's more comprehensive. You can have a tablet survey with 5 questions asking, okay, how would you rate your overall satisfaction? Do you have any comments or suggestions? You know, that sort of thing. I think there is value added, complementary value added through that process. Same with the online link to the portal or even the website, having a mechanism where a patient can go and share their concerns or their positive feedback. But in terms of a 30-question survey with quality reporting, I think your phone survey process, even if you implement it internally, is going to be a better process for you based on experience working with community health center patients.
That's some great feedback, Mark. I know that the sampling is extremely important, and it's so true that, the patients might kind of want to scurry out of the health center and get out of there quickly and not answer the questions as completely as they may if they got a random phone call. So thanks for the feedback. We do have another question. Um, they're interested in requesting a quote, and how long would the process take to be implemented with setup and training? And that's a direct question, I believe, to your services at Crossroads Group.
Yes, yes, yes. A quote, we can provide that within a day or two. We would just have a few questions, scope-related questions that we would ask, and then with answers to those questions, as well as some information about how many providers you have and or how many locations, etc. We can provide a quote, and anything that we contract in the month of November, we can start up in January of 2017.
Okay, great. Well, thank you so much, everyone, for your questions. Like we mentioned earlier, if you do have any further questions, please feel free to contact us here at CPG, or if you'd like to contact Mark directly, his contact information is on the screen. We really appreciate you being with us today, Mark, and we appreciate your feedback and all of your informational education that you provided, and I hope everyone on the webinar today was able to take something away. And if you're interested in getting started with Crossroads, they are a contracted vendor of us here at CPG, and we'd be happy to set you up with a time to speak with Mark if you wish to do so. And thanks again for being with us, Mark.
My pleasure. Thank you all for participating. Thank you very much.
Thank you, everyone. Have a great day.
Great day.